Hello friend, this is the last part of developing occlusion in permanent teeth. So today we will be discussing the Andrews key of occlusion. Andrews in 1970 explained the 6 key of occlusion, and he examined the 120 patient and gave the 6 key. The first key was molar interarch relationship. He explained that the distobuccal cusp of the upper permanent first molar occlude with the mesial surface of the lower second molar, and the mesobuccal cusp of the upper first molar occlude in the mesial group of the lower permanent first molar, and there will be canine and premolar, they will be enjoying their interdigitations. Now coming to the second key of occlusion, that is mesiodistal crown angulation. As we know that the permanent teeth, they are mostly the anterior teeth. Their crown is present mesially to the root, and the root is placed gingivally except the molars, so there will always be an angulation with the midline of the tooth. Then coming to the labiolingual crown inclination, it is mostly seen in the upper incisors, that there is always an inclination of the anterior teeth, and this inclination is measured from the 90-degree angle to the occlusion plane and between the tangent to the upper anterior teeth. This angle is known as crown inclination. Then coming to the fourth key of occlusion, that is absence of rotation. We know that rotation will occupy the more space in the dental arch, so in ideal occlusion there should not be any kind of rotation of teeth present, and teeth should be aligned normally. Now coming to the fifth key of occlusion. Fifth key was tight contact, that there is always a tight contact in the primary teeth and there is lack of spacing. Then the last key is the curve of Spee. Curve of Spee is nothing but a curve which starts from the cuspal tip of the mandibular canine, follows the premolar and the molars, and goes to the upper border of the ramus and up to the head of the condyle, and it helps during the mastication in human being. And it should not be more than 1.5 mm, and it deepens with age. Later on, the seventh key of occlusion was given, which is known as Bolton's discrepancy. This we will explain it in the model analysis, or the Bolton's discrepancy. This is nothing but the difference in size of the maxillary and the mandibular teeth, or the discrepancy in size of the maxillary and the mandibular teeth in the arch. It mainly tells the disproportionate between the maxillary and the mandibular teeth.